looking at the future and the breadth and depth of physiotherapy, it's exciting because it does offer so many different things. You know, your first job is not your last job. I think it's important for the profession to realise that variety is the spice of life. You have different patients, which gives you that variety, but there's definitely different options and opportunities through your career as a physiotherapist. And I think that really is important.
I think the physiotherapists of the future need to have a far more broader set of skills, and those skills extend beyond what we would traditionally consider standard physiotherapy practice, but are still important within our scope. So they need to be excellent communicators. They need to have counselling skills. They need to understand behaviour change and have strategies to support patients or clients to change their behaviour and their lifestyle in order to make a change to whatever it is that the physiotherapist is seeing that patient for.
I think the future of the Australian physiotherapy profession is really strong. I think that we are working in multiple sectors now, and I think there's growth in that. We talk about the ageing population, and we work heavily in the aged care sector. The disability sector is a growing sector. And I think that most of the community now are really looking after their physical and mental health and really want to look after themselves in that space. I think you'll find that we'll work much more in teams into the future, in multidisciplinary care with our medical colleagues and with our allied health colleagues.
I think a challenge for the future, and something we're looking to do, is embed technology more into our program and giving our students the skills to understand what it is and being able to appraise a new device and work out how it applies and the benefits of using that device, or the pros and cons of using that device for their patients or their clients. So we've seen implementation of technology lately in terms of telehealth and the uptake of telehealth, but it's far more than that.
There's also research that's in physiotherapy around innovative approaches of prevention rather than treating things. I think, like anything, workforce demands, but then also students or graduates thinking about the profession going forward, maybe a little more innovatively. They'll diversify a little more. Definitely, I know a lot of physios are changing their way of practice. I'm always interested when I analyse private practice as a physiotherapist. You're really governed by the patient in front of you.
We're trying to help our students identify what their clients can do and enhance that, rather than focus on what they can't do. But that enhancement of what they can do, that strength-based approach, also means being able to motivate or support patients to motivate themselves.
One of the things that keep health professionals in their profession and keep them growing is continuing professional development and further learning. So I think it's really important for us to support physiotherapists in their learning journey, whether it's taking on new roles within their workplace, being able to educate others, or take on new training or learning as they move through their career. We need to see careers as something that is flexible and innovative, so we're able to learn more as we go and be able to think about how we can work in new and emerging areas of practice.